Hello, welcome to the first webinar of a series organised by a new initiative called BESSI, Behavioural, Environmental, Social and Systems Interventions. I'm Susan Mickey. I'm Professor of Health Psychology and Director of the Centre for Behaviour Change at University College London. I'll just say a few words to introduce the concept of BESSI, and then we have two excellent speakers today. We have half an hour, hopefully, for general discussion and questions and answers from all of you who have joined us. And after I've said a few words, I will turn over to Professor Jeremy Grimshaw, who, along with Professor Paul Glasziou from Australia, have together initiated BESSI. The purpose of this collaboration is to bring together all those who are interested in research, interested in policy making, interested in implementation, in trying to reduce and suppress the transmission of COVID in our societies. While we wait for a vaccine, our only means of controlling COVID is through behavioural, environmental, social and systems interventions. And even when we have a vaccine, their uptake and hence their effectiveness will depend on people's behaviour. Yet investment in these types of interventions have been a tiny fraction of those spent on pharmacological interventions. Our aims are firstly to raise awareness of the importance of BESSI, also bring together a coalition of researchers, decision makers, implementers and funders to address this. Although the primary objective of BESSI research and activity is to reduce viral transmission to achieve zero COVID-19, i.e. absolutely minimise community transmission, there's also a longer term objective of reducing the likelihood and impact of future pandemics and also to help build back better. So we're committed to building a collaboration that is truly global in outlook and also in participation, that spans the breadth of disciplines relevant to all of this and sectors, and also addresses inequalities, which sadly have increased during this pandemic all over the world. And the collaboration will be very much based on translating evidence into policy and practice. So the BESSI initiative is moving ahead, starting with these webinars. Your participation and I hope networking and bringing more people into the coalition will shape its future. As I said before, it's being built by myself, Jeremy Grimshaw from Ottawa University in Canada, and Paul Glasziou from Bond University in Australia, who couldn't be with us today. We have a website, a listserv, and a Twitter account. So do follow all of these and get involved. We've organised the first 3 webinars, and I hope you've seen the details of them. If not, they will be put up at the end of today's webinar, and we're already planning the next 3. So if you would like to contribute to one of our quickfire presentations or know anybody else to suggest, please contact us. We're especially interested in contributors and participations from those in lower and middle income countries, where obviously the impact of COVID-19 is potentially so much worse. Just to say something about the Zoom facility, we have a question and answer facility, so please use that. If you'd like to contribute to the discussion, just put your question or your name into the chat, and either I can read it out or you can read it out yourself. So we will ask you to speak, and then we will you can unmute yourself to contribute to the discussion. We wish we could have had everybody's faces on here, but sadly the platform that we're using only allows the faces of the panel, but not everybody else. But at least you're here, and at least we can hopefully hear some of your voices. So without further ado, I'm now going to hand over to my colleague, Jeremy Grimshaw. Thank you.
Susan, and I'd just like to again welcome everyone. I see a lot of familiar names, but also lots of names I don't know in the chat box, in the participant list. So I'm looking forward to the conversation and also getting to know people better. I thought I'd just say a few more things about BESSI, the need for BESSI research before we introduce our speakers. So I apologise because I know you're all really waiting for them, but I'm going to just sort of take 2 or 3 minutes. And I think one of the things around this is when Susan, Paul and I started to talk about this, we were aware that governments around the world had been seeking input from BESSI scientists during the pandemic to a greater or lesser extent. Some countries did it really well, some countries did it less well. But one of the challenges was there's a lack of robust research evaluating BESSI interventions. So that meant these scientists were often working from general principles rather than direct empirical evidence. And one of the things that's quite remarkable is how successful behavioural approaches have been in this first phase of the pandemic, but it's far from ideal. And as we move, a colleague of mine talked about moving from the sprint to the marathon phase. I didn't think the marathon was going to last to 2023, so that's a bit of a depressing idea for the day. We are facing ongoing challenges about how best to maintain the necessary behaviours and systems, especially in certain population groups and in certain sort of contexts and jurisdictions. So our fundamental view is that we urgently need robust evidence to help further optimise interventions promoting personal protective behaviours, test and trace and isolating procedures, and then environmental system approaches to prevent transmission and mitigate the pandemic. This research will also need to have new interdisciplinary research teams that may not have traditionally collaborated together. So for example, if we're thinking about designing and evaluating the best ways to ventilate schools, we need to involve ventilation engineers and scientists, but also public health experts and behavioural scientists to really understand the interactions between the kids and the teachers in the school, as well as and how they interact with the ventilation systems. As we were preparing for the call, we noted that quite often human error is what actually derails systems, and the more we understand about human behaviour, we will hopefully avoid that. We also need to encourage replication across different settings and contexts. Too often we see the kind of public discourse is focused on a single study. We see the media pulling together a single study, which is really, which has been conducted in a specific context and probably reported because its findings are interesting. We probably have a huge amount of publication bias in this area that we're not even thinking about, or research bias because people are only choosing those interesting sort of events to actually study. So we need to really make sure that we are replicating research across different settings and contexts, bringing it together. And we also need to ensure that research done is across the global south. I think in northern countries, we are very aware of how much the pandemic has been a challenge for us, but for those people living in resource poor settings, this is the potential to be catastrophic. We need to know about the barriers and enablers to BESSI intervention across diverse global contexts so we can inform global policy and practice. And finally, we need to build living systematic reviews of the effects of BESSI interventions so that decision makers will always have high quality, up-to-date evidence about the totality of the evidence as they are facing decisions, because the pandemic is affecting the world in different stages. So what's relevant in the UK now may well be relevant in Canada, US in 6 weeks' time, in India in 3 months' time, and we would like to have evidence resources that will be there for those decision makers wherever they are and whenever they need it. So what we're trying to do is build a global research community to address this urgent interdisciplinary research need. And at the end of the webinar, we'll put up details of future seminars, but they're going to, for example, focus on the policy and funding environment for BESSI research, and also working in the built and living environment to try and reduce transmission. And as Susan said, we're really interested in hearing from you. So if you've got ideas for future webinars, if you want to present your work, we really are interested in that. So that's all I'm going to say. I'm going to take a breath in and introduce our speakers. So I'm delighted that we have two great speakers today. It's a kind of snapshot. It's very hard to talk about the totality of BESSI, of what we need to do in the BESSI area, but we thought we'd have two speakers who could just sort of basically give you some idea about the breadth of issues that need to be concerned. So our first speaker is Marieke Schomerus, I'm not sure I quite got the name right, but I think she's used to people not quite getting it right. And she's a vice president of the BESSI Centre for Behavioural Economics. She's a widely published researcher with a body of work on violent conflict, political contestation and peace processes in South Sudan and Uganda and across border, as well as behavioural mechanisms of post-conflict recovery. And Marika is going to give an overview of how behavioural research in the Global South is garnering insight into the lived experience of the COVID-19 pandemic. So I'm really delighted to invite Marika, and I'll introduce Atle just before he speaks. So Marika, over to you.
Wonderful. Thank you so much, Jeremy. And I'm really delighted and very honored to be the first speaker in this fantastic webinar series. But beyond the webinar series, in this kind of collaboration and the declaration of this collaborative spirit, which I, like Susan, think is absolutely crucial. I'm going to share my screen, and as Jeremy mentioned, I will be speaking kind of from the perspective of the Global South. I'm at the Busara Center in Nairobi, and so it's always helpful for us when we start a presentation to remind people what the world looks like. So this is what the world looks like according to population. If you know, it's obvious, you see where the big bulges are. And this is what the world looks like according to published research. If you look at what the empirical evidence base is that actually underpins published research and where it has been done, this is what you come up with. And you will see that all of a sudden, very quickly, Africa is very, very, very small indeed. And it gets even worse. In fact, Susan quoted in a recent articles of hers another paper that said 90% of COVID research is done in the countries that have around 10% of the world's population, and most of that is still in high-income countries. And actually, it gets even worse when you take this map, because when you take this map and you take, which is what something that Porteous has done very recently, and you look at all economics articles that are published on Africa, you find that 45% of all economic journal articles about Africa are about 5 countries. They're about Kenya, Uganda, South Africa, Ghana, and Malawi. So basically that covers 16% of a population of a continent that is already incredibly underrepresented in empirical research. And just as an aside, what makes you one of those countries that gets covered in empirical research? It helps if you're largely peaceful, if you have international tourists arriving. English as an official language is hugely influential in how much research you get and the population size. So I want to just set this as a preface to kind of prepare us for understanding just how big the knowledge gap is on COVID anyway, but just how big it is when we look at the Global South. And I will look mainly at Africa today, but let's have a look at what has been done so far in research. And I think we've come to a stage where we can almost talk about first wave and second waves of COVID research, which obviously seems to coincide with the disease progressing. So I think in the first wave, we saw very immediate concerns with very specific, detailed questions. And that was also obviously because nobody knew really a lot about COVID. So obviously we needed to latch it on to things that were already there. So what I've shown you here on this slide is some of that research kind of from this first wave of COVID research that we've conducted. And you'll see that it's really quite specific. That is also due to the nature that, in a way, it's impossible to do anything else but connect existing issues with some sort of speculation of how the disease will impact this. So we see that, we've done some work on the economic and social and emotional impact of social distancing. We're continuing to do some work on misinformation, particularly in refugee and displacement settings. But generally speaking, the misinformation topic is pretty big. Then, of course, it's about incentivizing the kind of behavior change that was hoped for, hand washing, etc. Obviously, health issues and economics impacts. And what was so interesting about this first wave of COVID research was this kind of tension between the need to implement some of the behavioral mechanisms that Susan had mentioned, so the social distancing, the hand washing, and the amount to which they were even available to people due to livelihood setups, due to living conditions, etc. And so there's a lot in the first wave of research that combines some knowledge about living conditions with speculation of how this might be impacted by COVID. But of course, it's very clear that if you live in very cramped living quarters and you need to go out for your livelihood, these ideas of social distancing and reducing numbers of people in the household and working from home and so on are very distant indeed and not really available. And that can also be true for things as hand washing, if water actually is very difficult to come by. I'm giving you some examples here of also other research initiatives that look particularly in the global south, because again, you see some themes, social protection, universal income acting as a buffer against the economic shock of COVID, quite some detailed work, again, much of it not underpinned yet, maybe with empirical work, but about the impact on women, both on their livelihoods, their day-to-day workload, the exposure to violence, including the safety that they have or have not in their own homes, domestic violence, and then a kind of separate research strand, which also Susan kind of hinted at, which is the ongoing, never-ending broader discussion of really how to get research into policy, how to translate a body of knowledge into a policy recommendation rather than just the very specific findings of a study. Just as an aside, in times of emergencies, what we've also seen is it becomes quite questionable through how much research ethics approval a lot of studies go. And this is something that I think that is a hugely important thing to keep in mind, because it's not been very stringent, to say the least. But now we're 6 months in. And now the second wave of COVID research, particularly when it comes to Africa, kind of has to start with confusion, because COVID hasn't panned out in most of Africa in the way it was expected. So the kind of doom and gloom from the beginning hasn't really quite materialized. And there's a lot of speculation and very little knowledge on why that might be the case, why it looks like some countries have passed the peak and why it seems like infections haven't ever been as bad as they were expected to be. Obviously, availability of data could be a simple reason, but we don't think so. And then there's speculation whether it's demographics, whether it's a younger age profile that doesn't make the disease quite so harsh. Is it environmental factors? Is it existing immunity due to a huge amount of respiratory diseases existing? People have respiratory diseases. Is it the fact that people just have lighter symptoms, that in the combination with less testing, it's really just not that visible? Or is this a knock-on effect of WASH programs, water and sanitation hygiene programs that have promoted hand washing for a long time? Or is it indeed the experience of Ebola, which meant that certainly some African countries were very, very quick with the initial lockdown and closing the borders measures? So what's interesting about this big difference, I think, between the knowledge in the global north and the global south is that in the global north, the problem is lack of specific detail, and we'll hear about this. Specifically, how is the virus transmitted? What kind of everyday life decisions might be safer than others? Whereas in the global south, what's really missing is the big picture. The global north kind of starts from a level of clarity and also an availability of data that you just don't have, and of course that means that in the global north, sometimes it seems like this availability of data allows much better judgment. Obviously, it's debatable whether that's really true, but you do start with a lot less knowledge in the global south. So in this second wave of research, what is needed? I want to give a shout out to the behavioral scientists that is coming out with an edition soon, which is edited by Neela Saldana and Sakshi Gai, who have asked this question, and it might be worth a read as well. It will be worth a read. I think what's really important to remember that despite the need to combine all these perspectives and link them with a behavioral perspective about this disease that at the moment only has a behavioral counter, capacity to do so is really very low. And I'm putting up this slide from the OECD that shows where behavioral science is conducted for public policy. And this is 2 years old, this slide, and I do this despite the fact that Busaras already existed and were not on the slide. We were forgotten, but I take lots of solace in the fact that Richard Thaler also pointed out that Chicago, where he works, was also forgotten. But I'm showing you this just to show how difficult this will be. So this multi-method, interdisciplinary research that also puts human behavior at its center. So what next for this second wave of research that I think is necessary and will start? So I think one thing that happens when you don't have a lot of data, and this is particularly prominent in the global south, is this idea of you start from needs, right? Needs assessment is such a prominent word, and these assumed needs are very different from societies where you have a lot of data, where you make kind of risk-based decision based on this data. So that's at the moment not really available, but yet it is necessary. It is completely necessary to reframe this understanding from a needs-based insight into a risk assessment, because this is what COVID will be, an assessment of risk for a long time. What's also really necessary and very hard to do is a much better understanding between how the systems and individual behavior link. And I'll go into detail on that in a second. And then particularly important to me is that's very often overlooked, that all of this is also deeply linked to politics, and linking politics, high-level politics, to individualized human behavior seems really hard to do, and yet is really necessary. Susan also mentioned in her introduction that at the moment there's waiting for the vaccine, but uptake of the vaccine is less than guaranteed. And this is where it becomes really interesting, because at the moment the vaccine, also in the global south, is kind of touted as a solution, but in reality it's a technical solution. Whether it will be one in everyday life will depend on how people feel about the vaccine. How people feel about the vaccine is deeply rooted in how much they trust the people who bring it. That could be governments, that could be health systems, that could be other authorities, how much they feel that COVID has been real. So the experience that the various countries have might be really difficult to convince people that vaccination is important. Obviously, there's deeply rooted social norms and culture that will feed into this. And so demand, we know already, is an issue. It has been an issue before, and this is very, very deeply rooted in trust in government and deep histories of how people have been governed. And the behavioral component is very often very hard to understand in this. So what I think is really still missing is this connected picture, this complex picture, the systems picture. And what I mean by that, I think, is best illustrated by the fact maybe what happened when 50, 70 years ago, the idea of the informal economy, the informal sector was formulated. When Lewis kind of made visible that actually there is a lot bubbling that is not captured in official statistics, and yet it is the driving engine. And all of a sudden there was a language, there was an image, there was something to explain something that didn't seem so visible. And yet we don't have that at the moment to explain the systematic connection between health systems, political systems, people's individual experience. So all these underlying factors, I think, really need exploring, and including the very specific behavioral mechanisms that will be very, very different in each location. That's kind of the raison d'etre of the Bustara centers, to say you cannot assume that these behavioral mechanisms will be the same all over the world, or even in similar locations. I'm very keen to understand this link between health systems that governments have set up within their own politics, with their own incentive structures, and how these links to how people experience these health systems and how much they trust them. Again, very, very difficult to do, very rare to look into these issues with the various lenses, with the behavioral lens, with an anthropological lens, with a political lens, and so on. And rare and difficult, and yet absolutely what is needed. And I come to the behavioral angle from the much more ethnographic side of things. And so I kind of want to sum up all these expressions of need by saying it is also on the research community to be patient with each other, because sometimes these can be really, really difficult collaborations. If you have an anthropologist talking to somebody who does experimental work, but these are exactly the conversations that we need to be having at the moment, and it seems at least until 2023 and probably beyond, to understand how the vaccines will actually be working and how they will be taken up by people. And with that, I'll hand back. Thank you so much.
Wonderful. Thank you so much, Marika. That was great. And just because of time, it's the first time we've run this, so we're kind of working out how this works. I think what we should do is move on to Atle, and then have kind of the first part of questions to both speakers, and then we'll open it up. One thing I would say, and we should have done this to start off with, and for future webinars we'll have a hashtag, but there are some people tweeting at this point in time. So if you are tweeting, please copy in at BESSI Collab, so we're aware of what's going on. So Mariah Ellen, for example, is quite active on Twitter at the moment, which is great. Thank you, Mariah. I need to go and find my notes for Atle. So I'm really delighted to introduce Atle Freitheim. I probably mangled his name again, but we've known each other for 20 years and I've never got it right. And he's the research director at the Norwegian Institute of Public Health and an adjunct professor at Oslo Metropolitan University. And in 2011 to 2012, he was a Norwegian Harkness Fellow in healthcare policy and practice. And over the last 20 years, he's been engaged in evidence-informed policymaking by conducting trials, preparing systematic reviews, and providing direct support to policymakers in Norway and elsewhere. And he's been very engaged in trying to conduct BESSI trials in Norway. And so he's got a lot of experience of both the trials and tribulations of trying to conduct these studies. And we're going to hand over to him and ask him for his advice. So Atle, thank you so much. Please go.
Thank you very much, Jeremy, for that. And I'm really grateful for getting this opportunity to share mainly the frustrations, I'd say, from trying to do some work in this area. Okay. So this is how I would sum up what we've done in Norway so far in this area. We have very few findings, and we have done a lot of work and have done a lot of process, which I guess is what most researchers would sum up their lives as, perhaps. But anyway, that's what we've experienced so far. I'm going to talk about 3 studies. When I say we, I have actually been involved in all these 3, but one of them very little. So I won't take the credit for this. The first one, which is the only trial that has been finalized in Norway, where I played a very small role, a minor, is the TRAIN trial. I'll come back to that. And then there is a school reopening randomized trial that I know that several of you have heard of, that has never actually materialized, and I'll spend some time on that, which I think is interesting. And then finally, I'll mention briefly an ongoing study, which is not a trial, more of an observational approach, basically an approach we've had to adopt in not being able to run trials, actually. The TRAIN trial, so these are the 3 studies I'll mention. The TRAIN trial was a study that was conducted, I think maybe it was the first BESSI trial in the world, and one of the few that has been conducted. It was basically this was conducted in Norway during lockdown, when all the training centers and everything else basically was closed. And the idea was that infection rates were falling, and there was a discussion about whether the training centers could reopen. And a group at the University of Oslo suggested running a trial, basically inviting members of gyms to be randomized to either be able to return to their gyms or not. So they randomized almost 4,000 members, and this was conducted the trial went over 2 or 3 weeks. And then they asked all the participants in the trial, both the control group and the intervention group, to self-test COVID-19. 80% of the participants did. The problem was there was only 1 case of COVID-19 detected among all the participants. So how do you calculate effect sizes, etc., based on that? That's a discussion, and there was some debate about the interpretation, obviously. The conclusion was that reopening of gyms was associated with low risk of infection spread, at least when there is so little infection. My main take on this, I'm a co-author, but had an extremely small role, so no credit for this. The people who did this, they actually demonstrated that it's possible, at least, to run a BESSI trial in a solid way. I was very impressed. They were able to get this up and running within a couple of weeks and conduct the whole trial, drive around to people who couldn't do the test themselves, etc., etc. Huge logistic effort in no time. Very impressive. And as you can see, as I've marked there, they posted their results already June 25th, like less than 2 weeks after the results were in. So that was a huge logistic effort. School reopening, which I'll spend most time on. Here's a short timeline. So in Norway, the school closed at 12th of March, and we immediately, actually before that, started planning and lobbying for a randomized trial. First of closures, but then the schools closed, so we started lobbying for a randomized trials of opening. We got very far. We had a meeting with the top leadership in Norway, the Ministry of Health, who applauded the idea and gave us strong moral support, even the Minister of Health. And then there was an internal discussion with the government, and then they ended up giving the thumb down and decided not to do it. This became not a huge issue, but an issue in the media, where the government was asked directly by journalists, why didn't they run the trial? We need this evidence, don't we? And what they responded was, and I really think this was their honest truthful assessment. At least part of the government, the Minister of Health in particular, was very supportive, but he did not, and the rest, at least the rest of the cabinet, did not think they had public support for it. And I think they're right, but that's another thing. The mood, like in most places, I guess, this mood has shifted back and forth. In the beginning, everybody, so to speak, was for closing schools. Then a month went by, infection rates went down, and everybody was for opening of schools. And this shifts back and forth. It's a bit polarized, but not as much as in the US, for instance. So yes, just to show off that we had a detailed protocol, and here's the setup, what we suggested doing. So we wanted municipalities to agree to participate, and the Ministry of Health said that he would probably see to that they agreed with a smile. So we had to have almost all municipalities in Norway to agree to randomize their schools. And we plan to randomize schools then for a few weeks and then measure outcomes for a while after. You'll see here why I say that, why I say those things. First of all, power calculations that we did indicated that we needed a huge participation. Practically the whole country would need to take part, which is a big issue in all BESSI trials, I think. How do you get enough data? The main outcome that we opted for after weeks of deliberation was to measure the proportion of tests that were positive among tested adults who lived with school children. We also included several other outcomes, which I think is important to emphasize when we discuss BESSI trials, is that we obviously are interested in the downsides of these interventions, not only their effect on infection control. So that was a failure, but we haven't given up. We're currently working on trying to gain support among decision makers for a decision plan to actually push on the button and initiate a randomized trial of schools if the situation changes for the worse and the government is considering to close down schools again, or in other ways intensify infection control measures in schools. We are not very successful, but we're meeting with the top brass of the Ministry of Health in a couple of weeks' time, which is, in my mind, too slow. But anyway, so this might change. But I'm surprised to say, and we can discuss this later if we have time, that there is much less enthusiasm for this approach than I had expected.
Very quickly, because we've only got 20 minutes left of our hour.
All right. Okay. Yeah. Well, I could actually skip this. This is an observational study that we're doing on universities to try to see if we can, you can see the heading there, which basically sums up what we're trying to do. We're trying to assess the relationship between in-person instruction and COVID-19 incidence among university students, which is a huge issue, especially in the US, but also other places. And here are my experiences from trying to conduct trials. And these are the barriers, legal barriers, ethical barriers, statistical power issues, and lack of political will or public interest. Cheers.
Thank you very much, Marika and Atle. Two great talks, starting from very general and then giving excellent ideas of the kind of studies we can do to build up our evidence base. So 20 minutes left, and on to all of you. Now, we also have a facility to put up the blue electronic hand, which I can see. So I'm going to call the first person from that. And Jake, do let me know if you see questions coming up in the chat. So first in, Nelly Hankinen from Finland.
I think she needs to unmute herself, Susan.
Hello.
All right.
But I actually, I haven't asked for to speak.
Ah, you had a blue hand up, Nelly.
But... Oh, sorry. Oh, sorry. that was a mistake. Sorry. I've just really enjoyed the talks, but I don't have any particular thing to ask. Sorry about that.
Okay, well, it's great to have somebody from Scandinavia with us, and Nelly does some great work on behavior change, systems change, and working with the government and policymakers in Finland. Jake, is there anybody with a question in the chat? While you're looking.
He is, Yeah, nothing in the minute, at the minute. Everyone's been...
Okay, so I would like to pick up on really the question of how we can translate the kind of activity that's going on anyway into designs that are acceptable and practical, so we can translate activity into evidence in the way that Atli's been doing. Really interesting to hear your experiences of it, both good and bad. And one of the designs that I'm very attracted to, and I don't know if anybody else here has got experience of it, is the step wedged design. And so this is where you're introducing something over a country. So for example, I know this happened in Germany with wearing of face masks, and that was actually a natural experiment where face masks were introduced in cities at different times. And so they're able to compare the before and after. And I have used this many years ago in a national study of hand washing amongst nursing staff in UK hospitals, where we introduced it across 16 hospitals, but had baselines for everybody, including for hospital-acquired infections, use of hand rub gel and soap, and also behavioural indicators of number of times that hands were cleaned in appropriate situations. And so we were able to, compare the effect of these kind of interventions, because we had it from beginning to end, but those 16 hospitals had the interventions at different times, and those can be randomized. So Atli or anybody else on the call, I'd be very interested to hear if you have experience of that, because I think it's a lot more practical than it is sometimes having randomized control trials, because everybody's getting it, and especially if it's being rolled out across the country and you have some control of how something's being rolled out. Atli.
Yeah, thanks. Well, for the school trials, school opening closures trials, I'm not convinced that they're helpful, or that approach is more helpful, basically because the concept of everybody getting it would be built in a classical trial also, because at the end you would decide whether all schools would open or close. So that issue's sort of, it doesn't add that issue that you would argue for in other contexts. Also, from my discussions, I've had that design in by the back of my mind all the time, and seize the opportunity, or be prepared to seize the opportunity to suggest that if I saw resistance, that you could be helped off by suggesting that approach. But I've never come across that situation where that would convince any of the people who were skeptical. And there's also not a logistical advantage for this particular issue, because on the contrary, I think it's better. It would be easier, I think, to implement something widely than step by step when it comes to almost national sort of interventions. So for that particular area, I'm skeptical. And then there's a power issue. I believe that step wedge trials usually require more power, but I'm not sure whether that's always the case. So for school closures, not so convinced.
Okay, thank you. In the chat, there's a question here from Carla Hemming. Do write what country you're from, by the way, in the chat. Carla's would like to ask Marika, if, Marika, you could expand on what you said about unethical research. Carla is an editor of trials and have seen concerns over this in protocols submitted. So that's a question. She's not quite sure how to unmute herself, hence me asking it for her.
Right, thank you so much for the question, Carla. Yes, so one thing that we saw with kind of amazement at the Busara Center, and we're a small player based in Kenya and Nigeria and India, but we were trying to get some research done, starting from March onwards, and submitting all the research ethics protocols to the relevant authorities in the countries. And we just saw everyone kind of bypassing us left, right, and center, starting to implement research, starting to do surveys, etc. And we just thought, this is really strange. How have they been able to get research ethics approvals so quickly? And we're very, very strict about this. There are all kinds of problems with this, obviously, but at the very least, we try to adhere to the standards that are part of the countries in which we work. And the answer was, many studies just didn't go through approval. Many studies just kind of went, well, this is an emergency, and there was a little bit of a race, obviously. So I think what will be really interesting to observe now is results coming out and looking at what maybe what justifications exist, but also what kind of ethical standards have been adhered to. And again, I don't want to suggest that ethics approval is the way to do ethical research, but it is striking to me that in the moment of crisis, these things were just bypassed. I wonder, Susan, whether could I speak to Dan Barlow's question in the chat?
Please do. Do you want to read it out?
Sure. So Dan Barlow asked whether evidence is enough. Is there an issue with misinformation and trust? And this, I think, yes, there obviously is. I think, however, this is a really good question to do a little bit of the mental gymnastics that I think would be part of BESSI collaborations, because there isn't, if you bring in anthropological perspectives as well, then understanding how information is received, how is it trusted, through what authorities, through what channels, what cultural and social underpinnings make information credible, obviously becomes part of an evidence package. So it's not, I completely agree, this cannot be a moment of saying, but we know better than you, so you just have to relieve us. We know for a fact that that doesn't work. It's blatantly obvious. However, if you look at it with a more holistic research perspective, then understanding why some of these pieces of evidence are not taken up is part of it, and that's what can open up, I think, much better uptake and ultimately evidence-based policy.
Yeah, this is a really important point, and you know, such an important point, and we're seeing it in many countries around the world. And really, when you look at some of the countries in which they've really done very well, both in terms of managing COVID and also in terms of their economy, one of the strands going through it is trusted governments. And you know, those, I don't really need to list them, where the governments aren't very well trusted, are really doing spectacularly badly. And it does raise a question as to how one rebuilds trust and how one generates other leaders away from the political leaders in society. And we in the UK have given it some thought. I'm on the Behavioural Science Advisory Group to the UK government. And one of the things that we have been really stressing in terms of rebuilding the trust is working with communities on the ground, you know, properly listening, engaging, working in partnership. And so you're generating solutions with the knowledge of that lived experience in the context of those people that are being asked to do things differently. And not only is that likely to come up with the best solutions and strategies, but also then there's a common ownership. You know, the communities own it, and therefore they're much more likely to do or adhere to the guidance that's so needed. So great question, and I'm sure we'll come back to this huge amount to do in that area. Marianne Ellen is asking about maintenance, saying, you know, there are groups in society that have been following recommendations for more than 6 months, but we might think of BESSI interventions to ensure they sustain the desired behaviours, as people may burn out soon. Now, this is I don't know about the countries that everybody's from, but certainly in the UK, this is a big issue that everybody's asking. You know, we're coming into a second wave, and how do we maintain the kind of collective solidarity and the good adherence we had first time around? Is there anybody from any country with experience or knowledge as to what have been effective interventions for maintaining adherence over the longer period of time? If not, do any of the panelists want to speak to that?
So Susan, I don't have any answer. I think I would say this is one of those areas where it's really important we do research. It's also one of the ways in where this might be more acceptable in a policy frame, because everyone already is getting whatever's in the background. And therefore what you might want to be able to do is, okay, let's randomize to some sort of intensification or some change in messaging. So it avoids the kind of concerns of nobody, you know, we're not doing anything for half the population. We're doing what we can, but then we recognize we need to work with, you know, with groups in particular areas. And I think this is one of those areas, particularly for these, the kind of personal social behaviors where, you know, we should be able to very quickly, given this pandemic is going on forever, try and get some of this research going, particularly probably in some target groups in Canada. It seems to be particularly people under the age of 40 that are probably being there's a whole range of reasons why, but probably are sort of not using as many of the personal protective behaviours as previously. So I think this is just a really important area where we should be trying to move into.
Yeah, yeah, great. Thank you.
Yeah, sorry.
Veronica, yeah.
I'm kind of combining your question with a question from Stephen Alomas from RMIT in Australia about localist thought, right? About it. I mean, you talked about the need to adhere in the long run, and Stephen is asking whether there's kind of localization of this, where people kind of form little clusters where they might or might not adhere. And this I find a really crucial point to make as well. I come at this from a perspective of conflict research, and of course, one of the things that we can expect once this goes on for a longer time is that othering will become stronger and stronger. We see this already, of course, in the Global South, where you have groups that are already maybe the target normally of police brutality and so on, that they now become the carriers, the scapegoats, and behavior changes between groups. And this is another really important thing to keep an eye on in the long run, of how to find ways to even out these ideas that there are certain groups and societies that are more dangerous than others because they're behaving in ways that aren't in conformity with the kind of suggested public health messages. So there's complex layers that really need unpacking.
Thank you. Thank you. Okay, we have a question from Julia Moore in Canada. And Julia, would you like to unmute yourself and ask it yourself? It's good to hear other voices. If not, I can summarize what you've put in the chat and everybody could have a look at what's in the chat.
Sure, I can unmute myself. So hi, great talk this morning. So I myself, and I know many other people who've been called in to help build out interventions that are being implemented, spread, and scaled very quickly. And ideally, we would like to be using existing data on barriers and facilitators, selecting strategies, using evidence and theory, and that just does not always seem possible, especially given their timelines. And some of the stuff we're drawing on right now related to long-term care homes seems like other people must have this information, but it's not yet published in research. And it seems like there must be great opportunities for us to share this across settings so that we can accelerate the process to provide people kind of the best available guidance for implementing, spreading, and scaling interventions.
Thank you very much. That seems very appropriate for you, Jeremy, to pick up on.
Sorry, yes, I actually did send Julia an email, a chat, just in case we didn't get to talk. I think this is absolutely true, Julia. We've been doing work in Ottawa, and one of the interesting things when we're doing that is we've been saying we're not necessarily doing this as scientists where we say we're going to have to study X, Y, or Z, but we're actually bringing what we know from our scientific background to help support policy decisions. But I think if we could find a way of learning from across other, and it sounds like you're doing the same, if we could find a way of really thinking through how we might be able to cull those and make sense of them, I think that could really help us move forward. So, you know, we're trying to think within the BESSI world, you know, how do we sort of make progress? And it might be, I'd really love to have some kind of behind the scenes kind of conversations with you in terms of, you know, can we, as we mobilize as communities, start to gather some of these experiences so that, you know, that can become part of the discourse of what and the experience that we share globally. So I don't have an easy answer apart from the fact that we should do this, and it would be great to talk to you about it.
Excellent. Well, this is one of the purposes of this collaboration, is really to network, to make connections. So some of it can happen within this, but also that's great if connections are made outside of it. I'd like to go back to Maureen Smith's question, who's a citizen from Canada. Maureen, would you like to unmute and ask your question? If not, I'm happy to read it out. Great. Hi, Maureen.
You need to unmute, Maureen.
Okay, sorry about that. It's pretty early in the morning here. So I just want to say that the work that you're doing is what resonates most strongly with me. When I watch the press conferences, I'm screaming at the TV screen. You know, where are the behaviorists? Where's the information about this? So I think I've been following your work, so I think it's very important. But are you going to leverage citizens? Like, how do you have a plan for how to promote your work, how to show the importance of it? I think people, you know, members of the public would really understand why your work was so important. So yet it's lacking, and it doesn't appear to be well understood. So will you engage with citizens, and how do you see that happening?
Maureen, that's a great question. And our plans are being shaped by these discussions with all of you. So this is a collective, collaborative approach to developing the collaboration. It really is just the beginning. And it's great you're here at the beginning. And it would also be great if you might consider being part of convening a citizens panel as part of this collaboration. So I suggest if you might consider that, to get in touch with us afterwards, and we can take that forward and find other citizens in other parts of the world to do this. Citizens are the heart of everything. In the UK, as well as being on the Government Advisory Committee, I'm also on a body called Independent SAGE, which was set up by one of our previous chief scientific advisors to the government, Sir David King, because he was very worried about the lack of transparency and engagement of the official government SAGE group. And we have weekly sessions, interactive, engaged sessions with the public and the press every Friday at 1:30 UK time. You can join it on YouTube. And we have questions and comments. We are a panel of 13 scientists from many different disciplines. And it's fantastic, the number of people who come on and ask questions, you know, including school students, including, well, all from all walks of life, as well as people from the press, on the basis that we want to be open, we want an open dialogue, and engaging citizens is at the heart. So in answer to your question, yes, this is definitely something we want to do. And secondly, it'd be great to have you involved. Any other thoughts or any other questions? We actually only have a couple of minutes. So we will, on the basis of this really good discussion, bring together the comments and notes from the chat function, from what people have said, from the contributions from Marika and Atlee, and post those on the website. And I'm just finally going to hand over to Jeremy, who will tell you about how you can keep in touch with us, have ideas for growing this collaboration. But I want to say thank you to the 60 people who joined us today. It was a first effort to try and get the most out of the hour we have together. And we had two very good, excellent speakers that stimulated some good questions and good discussion. So we will put this up on the website for others who weren't able to join us. We know there were many of them, to be able to catch up afterwards. Do keep in touch, both through these seminars and how Jeremy's going to inform you in a minute. And also, obviously, we're all at the end of the email. So great to meet and hear from some of you, and great to know that there were many more of you joining in at a distance. So Jeremy, over to you for presenting the slide and final words.
All right, so thanks a lot, Susan, and again, thank you very much to Marika and Atlee. I think one of the issues across the two presentations is they just demonstrate the breadth and depth of the work that needs to be done. This is a huge agenda. We need progress on all of these fronts if globally we're going to address the pandemic. So I thought they were great. So as Susan said, we have the next 3 webinars all planned. So on Wednesday the 14th, we'll talk about policy responses to COVID with Molly Byrne and David Kine. on Monday, the 26th of October, the funding environment for COVID, and we have Marissa Creator, who's going to talk about the UN are going to publish a COVID research roadmap shortly, so she's going to update us on that. And João Rango Almeida, who's he's at Welcome, but actually he's the co-convener of the Social Sciences panel in Glopidar, and we were asking him to talk about that. And then, so those are very much about kind of the scene setting, and then we're going to dive back into the research, and we're really pleased that we've got a great panel on engineering approaches to COVID with Lena Sirik, Leora Malki Epstein, and Nick Tyler. So please join us, put them in your diary. If you've got suggestions about future webinars that you would like us to do, or you would like to present your own work, please let us know. And then if you want to stay in touch, we have a JISC listserv, which is actively encouraging discussion between the webinars around this, where you can talk to colleagues. We are on Twitter with @BESSI Collab. And then also we have a website, which is actually what the URL is, where you can join the JISC mail, and an email at bond.edu.au. So please, if you're interested in this and you want to contribute and you've got ideas about how we can build community, how we can develop a global research agenda, or future webinars, please let us know, because this is only going to succeed if, as a community, we come together and basically take on this this sort of huge task collectively. Thank you for your time today, and we'll see you again in 2 weeks' time. So thank you.
Thanks, everybody. Bye.
Thanks a lot, Susan and Jeremy.
Pleasure. Thank you.
Thank you, Marika.
Thank you. Bye-bye.
Bye.